I'm sorry, can you say that all again? Because I'm not really understanding. What did you say the copay was?
The copay came out to be $3,981.07.
$3,981?
Yes, ma'am. That's how much it came out to be.
That cannot be possible because I've been on this medication for probably 6 months and I've never had to pay a dime towards it. Did you say, how much did you say insurance is covering?
Insurance covered $4,648.19.
And then this is for how much? So insurance covered $4,000 something, and you're saying I still owe almost another $4,000. So you're saying this medication is $8,000?
Yes, ma'am, it is. It's $8,629.
It's a 1 month supply. Okay. I was just gonna say, like, is there a way to find out what happened with the insurance?
I'm a benefit verification representative, so all we do is process the claims.
Okay.
I'm not really sure how they do it on the insurance side, but
okay.
When I see copays like that,
I don't think this is right. There's no way I can afford almost $4,000 in this medication right now.
Yes, I understand. That's why I was trying to offer you copay assistance.
What's the copay assistance mean?
It's called the Pay My Way copay card. They will give you a copay card and also a virtual debit card, and it will pay that for you.
So I would sign up and then get a virtual debit card. How much am I paying for it?
They offer annual benefit of $10,000 per calendar year, included at $0 every month for due cents.
Yeah, how do I go about getting this?
I can give you their phone number and also their website. You can actually call them today and go ahead and get enrolled. And then once you get your that copay card information, go ahead and give us a call back.
Is there a number that I can have to call you back?
They sign up for that copay assistance program. They paid it straight through.
So it's basically just extra hoops I have to jump through to get this copay card.
Yes.
I like to make it very easy on this.
I've always been told that medication in the US is really, really, really expensive because people who invest in research have to make their money back somehow. So while the medicine itself might only take $5 or $10 to manufacture, they spent millions and billions of dollars on the research behind this product, so they have to disperse all that cost onto the product. And that kind of made sense, sure. But explain this. This is Eraslo. It is 0.045% terazatine lotion, and it is how I have less breakouts now than I did a couple years ago. I paid $200 for this lotion, and that was after my insurance paid like $400. So this lotion was $600. Yes, honestly, it was worth it. The $200 was worth it because you should have seen my skin before. Anyway, pay attention to the concentration, 0.045%. Now, I'm in Egypt, and I bought the same exact active ingredient, but the concentration is 1%. Care to ask how much I spent on this cream? 15 Egyptian pounds. That amounts to 30 cents. So, repeat back. Okay, the concentration is 20 times? Is that how that works? Is it 20 times as strong? 0.045 versus 1 is, about 20 times as strong. And a bajillionth of the price? How does the manufacturer of tazarotene or whatever make back its investment money if other countries could sell the same exact thing for like literal pennies?
I just finished 30 days of radiation for a rare brain tumor, and I was like, I wonder how much this would cost if I didn't have health insurance. So I added it up. I scoured my insurance records and like all the claims and put together everything that I could think of. I spent like 20 minutes doing this, so I probably missed some stuff, but put together everything that I could think of that I've had done in since the beginning of 2022 for my rare brain tumor. And this is the cost. Literally $250,000. How do people without health insurance take care of that? Like my brain tumor, yes, it was rare, it was bad, wasn't terminal, wasn't like, I didn't need any super serious extra things happening, whatever. I had 30 days of radiation. Every day they do a little x-ray to like make sure the radiation is like targeting the right spot. 6 weekly check-ins, 1 per week during my radiation, 6 MRIs with contrast. So this is just the medicine that lights up the tumor. A CT scan, oral chemo, and blood work. Guys, why did it cost $250,000? Like, I had insurance, thank God, but how do people, seriously, without insurance, like, they would be broke for the rest of their life. Like, they're already going through such, like, a health crisis. Why do they immediately have to be put in, like, a financial crisis? Like, this would take away from, like, people's, like, houses, bills, food. There's something seriously wrong with America's healthcare system.
70% of the doctors who looked at how much they were going to get reimbursed said, we're going to have to drop these plans. 70. You better keep your appointment. Those who have Medi-Cal, Medicaid, any type of state or federal funded insurance plan, whatever it is you need to get done, I suggest you get it done now. Whatever appointment you have scheduled, I suggest you keep it. If those folks say to come tomorrow at 3, I suggest you go. Because come July, when that big, beautiful bill kicks in, most of these offices, medical, dental, most of these facilities, whatever surgery that you've been putting off because you just didn't feel like going, whatever little office you just kind of felt some kind of way because they didn't want to accommodate your schedule, a lot of them are going to drop these policies. A lot of them. They're going to get paid so little on the services that they render that they will not be able to afford to see you because there are going to be so many cuts. All the money that was funding these programs, they went over to war. They've gone over to Israel. They went over to Argentina. Trump sued the government. Now it's in his pocket. So if you voted for Trump and you need knee surgery, or you need a crown, or you need to get a checkup, just know you did it to yourself. If you have a parent that needs any type of nursing assistance, just know you did it to yourself.
So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance. Your insurance only paid $1,078.85.
Can I go back to the discount without the insurance?
No, so you're insured, so you're not eligible for the discount.
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
Oh, I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper health care if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
Is this common? Like I pay for insurance and I end up paying more out of pocket because I pay for a premium? That's wild.
This is just a new law that passed, started 2024, AB 716, and the law is if you receive a discount if you're uninsured.
Okay.
So when we first send a invoice to the patient, we bill them as if they're uninsured. If you're insured, unfortunately, you're not eligible for the discount.
Okay, so just...
Now, I knew healthcare in America was a joke, but I truly had no idea what I was really in for when I turned 26. If you're unaware, in America, when you turn 26 years old, you can no longer be on your parents' medical insurance. And because my birthday is next month, I have to now set up my own. And oh my fucking God, I'm going to throw up. Obviously, my first choice was to stay with my provider, right? Because I've had them my whole fucking life. And because I would be signing up for insurance as an individual rather than through an employer, this was the cheapest plan they could offer me. $285 per month with a $6,000 deductible and $60 copays every time I go to the doctor. Ooh, let's not forget the $90 if I get sick and need a prescription. So let's do some math. I'm a pretty healthy girl. I only go to the doctor maybe once a year. So $285 a month for 12 months. That's $3,420. Plus the $6,000 deductible, which is $9,420. Plus the $60 for my doctor's visit. Plus the $90 in case I need a prescription. That's another $150, bringing our grand total to $9,570. That's $9,570 out of my pocket before insurance even covers anything. To me, these are exorbitant numbers. But then I post that shit on Twitter and people are like up my ass telling me that that is cheap. So I'm even saying I shouldn't be complaining. Forgive me for believing that any amount of money for care that I need to sustain my life is too damn much. And of course, I'm neurospicy, okay? Once I get into something, it's like a rabbit hole that I cannot stop. So I start doing further research. Is it even really worth it? Like, if something does happen, how much is it going to cost and how much is insurance going to cover? So I'm like, okay, what is the average cost of one night in a hospital? The average cost per day in a hospital in the US is $2,883. But I live in California. So that's looking more like $4,181. Well, then I tried to research how much of that actually gets covered by insurance, only to find out that insurance companies, people without medical degrees, can decide you don't need the treatment that your doctor is saying you need to live, and then they just won't cover it. They just won't cover it. This is what the grown-ups be doing? This is your fucking life? This is gonna be my life? How is this sustainable? I'm sorry, I am truly baffled. What's most shocking is this is normalized in America. Like, there were people on Twitter trying to convince me that this was normal. This isn't fucking normal, guys. It's not fucking normal.
The U.S. healthcare system is broken. Do not allow you or your loved ones to be discharged from a hospital if it is not safe. You have the right to say this is not a safe discharge. Had a patient who, these are my lunchtime rants, had a patient who was sent to us by the hospital. Just the clinicals, we did not realize that the patient was already discharged. Found out that the discharge happened at late last night. Like, the patient got home at almost midnight, and the patient didn't even know that they were being discharged. The patient's daughter didn't know. The patient's 99. What we also didn't know is that because of 0 clinicals that we received about a Pleurix catheter that had been placed. So we found out this morning because the daughter called saying, where are you? You're supposed to come and do all of these things. And it's like, we didn't even know you were discharged. We didn't even know your mom had a Pleurix catheter placed. And the daughter had 0 training in the hospital. So no ordering of supplies, none of that. And didn't even know that her mom was going to be discharged until 10 o'clock last night when they said, oh, by the way, EMS is coming and taking your mom home. Do not allow the hospital to discharge you or a loved one if it is not safe.
I just need to complain for 1 second about our godforsaken healthcare system. Okay, so about 3 weeks ago, almost 3 weeks ago, maybe a little more than 3 weeks ago, I overextended my right ankle, like the back, like the Achilles tendon area. My amazing kitty tripped me when I was going up the stairs to the basement, or from the basement, and hello, there he is, thank you, that amazing kitty. I overextended my ankle while I was trying to regain my balance. Since then, it has been increasingly painful, but I don't go to the doctor for myself because, for one, I don't have the time with the kids and work and everything else. It's hard for me to take time out of my day to do those things. But for two, even if I wanted to go to the doctor, I can't afford to. So I am making, in my professional career right now, I am making more than I ever have previously in the other jobs, which makes sense because I've been at this place for almost 9 years, and I have a role in management, and my salary it's decent, but I'm still, with having kids and a mortgage and the bills and all of that, I'm still very highly debating getting like a weekend job to help pay my bills. So I'm not rolling in dough by any means. But I do have health insurance through my place of employment. So I pay my insurance every paycheck. I have a pretty high deductible, so there's that. But when I had COVID back in January, and I went to urgent care to get swabbed, after insurance, I paid over $500 out of my pocket for that COVID test. And I get it. I work in healthcare, animal healthcare, but healthcare nonetheless. So I get that there's a fee. You go to the clinic and the technician does the swab, and then you have to pay for the doctor's time, and then you have to pay for the lab charges, and the clinic then has to pay the lab for them to run the tests, and they have to recoup those costs. I get how all of that works, but I can't afford, as a 38-year-old woman, I can't afford to go to the doctor to have my ankle looked at because they're going to want to take an x-ray. They're going to want to do all of the things. And I simply just can't afford it. I can't afford to have it looked at. And don't come at me. I know you're going to come in the comments and say the more I walk on it and the more I do all the activities on it, I'm just going to make it worse. I know all of that. And I'm not going to be able to afford to get it fixed at that point either. This is more for me to vent and kind of bitch and moan at the godforsaken state that our shitty country is in when it comes to, their citizens and healthcare and all of the things. It should not cost me $500 out of pocket for a COVID test when I have insurance. I don't get it. I don't get it. And I need it looked at. It hurts. I'm still doing the things. I went to my first workout class yesterday, and I was just kind of took it easy on that side. And so I'm not letting it ruin my life, but it is increasingly painful. And I know that there's something wrong with it. And it just sucks because I can't physically afford to go to the doctor. How are other people making this happen? How do you prioritize your own health care? What are you doing? What are you doing to afford to go to the doctor? Because I need those tips and tricks. It's getting bad. It's getting bad. It makes a crunchy noise when it's bad. So help me. What do you do? How are you affording to live right now?